Theresa Betancourt, lead author of a study with child soldiers in Sierra Leone, published in a special issue on conflict, violence and health in Social Science and Medicine. Theresa, you have a provocative title for your paper, Past Horrors, Present Struggles. Why did you choose this particular phrase to summarize the experiences of child soldiers?
Well, we chose that phrase because we are interested in capturing different aspects of the experience of armed conflict on children. When we speak of the past horrors, we're talking about the war experiences, including we looked at a number of factors such as surviving rape and participating in the wounding and killing of others. But we didn't stop with just that or a cross-sectional view. We were very interested in the post-conflict environment. So we looked at a number of factors that characterize that environment, including family support and acceptance, community acceptance, and the experience of discrimination, which we use as an indicator of stigma in our analyses.
Now, surely to work with child soldiers is a very challenging area of work. Tell me a little bit about how you undertook this.
It certainly is. It's very hard to find these populations. There are a number of ethical issues involved with conducting research in a way that's safe for participants. We were fortunate to partner with the International Rescue Committee, which is a well-known international humanitarian organization that was involved in the demobilization and reintegration process in Sierra Leone and was running a number of interim care centers, or an interim care center in the Kono region of Sierra Leone that served about 5 different areas around it. So we were able to draw our sample from their roster of young people who'd been replaced into the community during the most active 8-month period of resettlement. Another important part of that was that there were males and females in that sample on those rosters, which is a contribution we hope to make. Prior research in this area had looked mainly just at young men.
So why is this study particularly important? What is the particular science contribution of it?
What we really were hoping to do was shed light on more of this developmental course of the impact of armed conflict on children. So rather than just taking a cross-sectional snapshot of experiences, to look at the process over time with a prospective longitudinal design. So we're able to interview these young people when they first returned to their families and communities in 2002, and then follow them up 2 years later in 2004, and look at a number of factors that characterize the post-conflict environment as well as their past experiences.
Great. And lastly, what are the main take-home messages for research and humanitarian action?
Well, I think the implications for research are, again, this need, if we're going to concentrate on child development, that we take a developmental perspective, and this means investing in longitudinal studies that really can look at more of a life course perspective. It also has implications for services, in that services are often planned and implemented in a very short-term humanitarian emergency focus, and we don't think about that transition from conflict response to development and the post-conflict environment, and that factors like stigma, issues of family placement and acceptance, all of these things unfold over time, but a lot of our programs don't put into place mechanisms for monitoring these issues or addressing them as they take place. Another important aspect of this relates to looking at community-level factors. So certainly there are young people who may benefit from individual interventions, but we also have to think about community-level interventions. And after the war in Sierra Leone, there was a lot of attention paid to these sensitization campaigns to open up a conversation about the return of young people home. And from our data, qualitative and quantitative, which was used in the study, we see that these campaigns were very important. The issue is, can these processes be addressed and sustained over time? And there may be instances where booster efforts or additional efforts to address stigma and discrimination really need to be attended to long after the end of war. And so we'd like to draw attention to that as well.